The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Back pain. It affects millions of people, often to the point of immobilization. Beyond traditional treatments, there may be a surgical solution for relief. As we age, our health risks increase, and so do the costs. Can properly planning our financial future help? Every 11 minutes, a woman dies of breast cancer, but there is hope. For those at high risk, a new drug therapy may prevent the cancer from even developing in the first place. Sardines and heart disease. It may be surprising to find out the correlation between the two. On-the-job injuries can affect both the employee and employer, but having a company program can make a difference. And what if you could become healthier and wealthier by subscribing to a magazine? All these topics are next on Today's Health. This show is brought to you in part by the Bonatti Institute, the Society of Financial Service Professionals, Zeneca Pharmaceuticals, King Oscar, Kemper Insurance Companies, and Publishers Clearinghouse.
Of all the goals we can strive for in life, few are more worthy than maintaining our own health, happiness, and well-being. Hello, I'm Faith Daniels, and this is Today's Health. It's often difficult to feel upbeat and happy when we're suffering severe back pain. In fact, for some people, back pain can be so overbearing it can actually immobilize them. Fortunately, though, there are some new techniques to help relieve pain and get people back on their feet again.
It can happen at any moment, from lifting, a bad fall, or some other injury. Suddenly, back pain becomes so intense and severe, it can immobilize you and prevent you from working and living your normal lifestyle. In the United States, about 8 out of 10 people will suffer a back pain problem during their lifetime. In fact, back pain may be responsible for more missed work days than the common cold.
My back problem became so bad that I became bedridden. I could not even turn myself in my bed because of the pain in the lower back.
When analgesics, prescription pain relievers, and physical therapy fail, surgery often becomes the alternative for pain relief. Recently, an arthroscopic outpatient procedure using lasers and tiny, minimally invasive incisions has allowed patients to go home and walk the same day after surgery. This operation, patented by the Bonatti Institute, is performed while the patient is awake and actually watching the surgery on a monitor.
I could actually feel the pain decreasing as he worked, and I could see my disc. I could actually see my disc and him working around it. And as soon as the pain was gone, I was so happy. I said, that's it, it's gone. Totally gone.
The advantages of the Bonatti procedure versus the open surgery is the anesthesia. We use local anesthesia with the standby anesthesia. Possibilities of an infection with an arthroscopic procedure are minimal. The patient has not need of narcotics or pain medications after the surgery. We can challenge the open surgery completely, and we are far with better results and less complications.
I don't go to my bedroom just to go to sleep at night now. My husband and I, we now have plans to do things together. We are able to share a life now and be happy and look forward to even just the new day, whereas before we had no hope for anything.
Living with back pain is an agonizing reality, and the loss of mobility can affect nearly every other aspect of your life. Fortunately, there are alternatives to help relieve the pain and get you back on your feet once again.
As we get older, our risks for developing many diseases increase just about the same time our earning potential decreases. While Medicare and Social Security can certainly help, they are often not enough. Your financial planning during your earning years can be the key to keeping your retirement years the golden ones.
Where do the years go? Does it ever seem like just yesterday you were getting ready for the senior prom and today you're starting to count the years to your retirement? The golden years can sneak up on you, but if you're not properly prepared, they may not be so golden. Living on a fixed income can be quite a challenge. Social Security and company pensions can help, but often they only account for about half of the income needed to maintain the same quality of life enjoyed during working years. Unfortunately, increasing age can also bring a greater risk for many health-related challenges. And even with Medicare, increased medical costs, prescriptions, or an extended illness can tax an already limited fixed income.
When it comes to planning for retirement, I would focus on my life expectancy considering my health. Now, you should know in that regard that the average person who's 55 years of age can expect to live from 20 to 27 more years. A 65-year-old can go for another 14 to 18 years. But the big thing here is to remember, with medical science, you can live longer than that, with changes that take place. Also, understand that the big fear today is not dying too soon. It's living too long and outliving the financial resources you have.
Even though it may seem years away, planning for retirement and estate planning should start in your earning years. There are many alternatives to consider, like individual retirement accounts, 403Bs, and 401Ks. Other options like life insurance and equity funds can help accumulate a nest egg large enough to keep the golden years comfortable, no matter what challenges occur.
Hi, Rose.
Hello there. How are you?
Look for qualified financial professionals, like a member of the Society of Financial Service Professionals. They can provide information and education about retirement and estate planning, and many other questions concerning your future monetary position.
Members of the Society for Financial Service Professionals are primarily CLU and CHFCs, and these are people who have passed a battery of exams that make them prepared for working with the general public and being able to advise them, as well as being members of estate or financial planning teams.
When it's time to get serious, you need a good person that you can bounce off ideas with and philosophy and everything, and that's why it is extremely important that you get a good qualified investment counselor.
Planning for retirement is essential in having a comfortable retirement. Just to be able to accumulate what type of assets, calculate what inflation may do to those assets, and what our living standard may be in retirement.
The sooner you start saving towards your retirement date, the better off you will be.
People are living longer now than ever before. The retirement age of 65 is just the start of 20 to 30 more golden years. With proper financial preparation and planning, those years can be more carefree and rewarding than all the time before.
It was earth-shattering, basically. It was the worst news that I could possibly have gotten.
With breast cancer being the second leading cause of death in women, detecting it early is crucial. But what if it could be prevented from ever developing? For high-risk women, it might just be possible. Stay tuned.
Every year, more than 180,000 women in the United States face a terrifying diagnosis: breast cancer. In far too many of the cases, it can be deadly. But now more women are surviving breast cancer than ever before because they're taking the proper steps to detect it early.
It's a disturbing fact. In the United States, a woman dies of breast cancer every 11 minutes. 1 out of 9 women will develop the disease in her lifetime. And each year, close to 44,000 women will die from this deadly disease.
Breast cancer develops when a typical cancer cell divides and multiplies uncontrollably and eventually forms a mass or tumor. The tumor cells grow in many cases due to estrogen.
A tumor will actually most often be confined, or will often be confined to the inside of the duct, or at least confined to the breast. The longer the tumor stays there, it not only increases in size, but it increases its potential to spread to other organs in the body. And that potential of spread is really the thing that is life-threatening.
When I first thought or suspected that I might have a lump, the first thought that went through my mind was, am I going to make it? Am I going to see my kids graduate? So I think that those were the most difficult steps, because all of a sudden life became such it was a reality for me, and how delicate life is also was very foremost in my mind, and how it could so quickly end.
There are several key risk factors that can increase a woman's chance of developing breast cancer. Increasing age, genetic factors, and a family history of breast cancer can place a woman at higher risk for developing the disease.
I think that the factors that put me at a higher risk is the family history. My sister and my mother both passed away from breast cancer at an early age. My grandmother's a survivor of breast cancer.
In addition, having no children, children after 30, early menstruation, or a history of previous breast biopsies can also be factors.
Approximately 180,000 women develop breast cancer every year, and only about 43,000 die of breast cancer.
It's important that every woman realize she is at risk and practice good breast health, including talking to your doctor about your personal risks, performing self-exams, and having annual mammograms.
The bottom line is that a mammogram can detect changes in the breast that represent cancers that are extremely early, even at a stage so early that they haven't yet penetrated through the duct and have no potential to spread.
Modern medicine has given us new and better ways to detect breast cancer and to treat it. Now innovative therapies may have even opened the door to prevention.
There are many promising drug therapies as well as improved surgical techniques that are helping more women survive breast cancer than ever before.
The vast majority of women with early breast cancer are destined to be cured of their disease if treated appropriately. The majority of them will require some surgery, probably radiation therapy, and in all likelihood, the administration of either hormones or chemotherapy or both.
The type of treatments based on the cancer I had required that I had first the lumpectomy to remove the lump, the cancer, and when that was biopsied, I had 4 positive lymph nodes. As a result, I had 9 months of chemotherapy, together with 6 weeks of radiation.
Recently, the FDA approved the use of Nolvadex, or tamoxifen, as a drug therapy that could potentially prevent breast cancer from developing in women at high risk for the disease.
For the first time ever, we're able to answer the question as to whether we can or cannot prevent breast cancer. The answer is we can.
In order to grow, many breast cancer cells require estrogen. What some preventative therapy does is attempt to block those estrogen receptors on potentially cancerous cells so that the estrogen cannot reach them and help them grow.
My favorite analogy is to say that tamoxifen acts like a key that can get in the same keyhole as estrogen, but it can't do anything, it just sits there. But now it's blocking that keyhole, so any estrogen that a woman has in her body, it just can't get onto the same cell.
I was starting to have lumps and different things. I had 3 different biopsies, and the surgeon was concerned. After I've been on it, I haven't had any more problems.
Like all medications, there are some side effects, but the main symptom that women experience is hot flashes, maybe some of the other drying symptoms that women go through with menopause. The most important medical side effect is the potential for cancer of the uterus. Now, this is not anywhere near a common side effect, but because of its serious nature, we have to talk about it and weigh it in the decision.
I think the biggest message is that we can get through this. Women and men as well who get breast cancer can get through the treatments. Attitude, faith, family, friends, those all play a very important role, but mostly your outlook and being positive that you can make it, especially with today's advances in science, are probably the best message I could give to anybody.
Breast cancer is a very deadly disease, but now we can detect it, treat it, and sometimes even prevent it. Perhaps there will be a time someday soon when we might be able to cure it.
Seafood has always been a source of omega-3 fatty acids, which help lower cholesterol levels. And surprisingly, one of the smallest fish in the sea may have the biggest impact. On-the-job injuries can have both physical and psychological effects on employees. What if a program helped prepare workers to return to their jobs healthy while keeping an employer's costs down? We'll show you how, next on Today's Health.
Lately, research has shown that besides their nutritional benefits, the fatty acids known as omega-3 have a wide range of preventive properties against disease. What's even more amazing is that one of the ocean's smallest fish is one of our greatest sources of this nutrient.
There is an increased awareness of the devastating effects of fat content in foods and their impact on cholesterol levels. Health experts have been examining certain dietary nutrients and their effects on lowering cholesterol levels, as well as their risk-reducing effects on certain diseases. A unique form of polyunsaturated fat, omega-3 fatty acids, or fish oils, has been shown to protect the body from a variety of ailments such as heart disease, stroke, and arthritis.
They actually are very effective in lowering lipid levels, such as triglycerides, which are a risk factor for heart disease. And they also have the ability to raise the good cholesterol, which is important for the prevention of heart disease.
Additional research last year from UCLA points to omega-3 as a breast cancer inhibitor and as a factor in treating or preventing rheumatoid arthritis, migraine headaches, high blood pressure, kidney disease, and asthma.
Seafood has always been acclaimed as the best source for omega-3 fatty acids, so we set out to find the best seafood source for this nutrient. Amazingly, we discovered that one of the smallest fish in the sea has one of the highest levels of omega-3 fatty acids. Sardines.
There really is no such thing as a sardine swimming out there in the ocean. It only becomes a sardine once you put it in a can. And the very, very best sardines are found in the coldest waters in the world. A bristling sardine is what we call the very small sardines that are found in Norway. As I said, sardines can be made from all different kinds of fish, usually related to sprats, and the sprats are related to herring. But the smallest in the world, those who know their sardines know that the gourmet sardine comes from Norway.
Research has suggested that there is an inverse relationship between the incidence of breast cancer and the level of fish consumption, suggesting a protective role for omega-3 polyunsaturated fatty acids toward breast cancer in women. It has also been seen that omega-3 produces an acid which can positively affect the brain and reduce the development of depression. With all the benefits of a diet rich in seafood, many families are adding or increasing their consumption of it. One of the smallest fish in the sea, the sardine, may very well be the king of the sea.
An on-the-job injury can raise many troubling issues for the injured person. Will the job still be there when they return? How will they handle their expenses while recovering? And who pays the medical bills? It can all be pretty overwhelming. But fortunately, there is help in finding the answers.
In order for businesses to be competitive in today's demanding marketplace, they have to protect all their assets. The most important asset for companies today is their employees. Keeping them healthy and on the job is critical. Workers' compensation and short and long-term disability are two programs that are integral to healthy employees.
Employers can spend as much as 8 or even 12% of their payroll dollars on employees who aren't working. They may be off the job because of an injury or an illness that may have occurred on the job, or it may have occurred off the job. When managed care was introduced, employers saw their medical costs go down. The problem is that managed care puts the emphasis on the managed. And so it reduced access to medical care, and it delayed employees in getting back to work because they were waiting to get medical care.
Most employees would rather be productive at work than sitting at home waiting to get better. But they need help.
Healthy Return Plus was developed by Kemper to help employees get access to medical care and get back to work, and to help employers reduce workers' compensation costs, disability insurance, and the administration issues involved with both programs.
It's very important for us to get our employees back to work quicker. Our employees are our resources. They are what's important to us as an organization. So for us to allow employees to return to work on a more timely basis is a big plus.
First, a nurse care manager listens to the ill employee to be sure all information is considered to get quick access to the right specialist. Then the nurse makes sure the employee understands the illness or injury and that all treatment issues are clear.
Frequently what happens is a patient will leave an office and not really have an idea of what the doctor's just said. It's an opportunity for us to get in there, reinforce the medical plan of care, help with patient education, be a patient advocate, and by doing so, the patient gains much more understanding of their disease process or their injury. And we really want to focus on helping the patient understand what's wrong with them in order for them to be most compliant.
Well, this program saves our organization money by getting our employees back to work in a quicker, more timely manner, and as a result, we have the productivity of that employee to contribute to our organization.
Getting access to the right medical care and someone to help you navigate through the process is crucial for the health and welfare of employees and their companies.
There's a limit to the amount of information we can give you in just 30 minutes, but the internet is virtually unlimited. So visit our website at vstar.com and find out more. An old saying claims knowledge is power. That adage still holds true today, especially when we're discussing our health. If it's important to you to make better informed lifestyle choices, then you may want to learn as much as you can about what's known and what's on the horizon.
It seems like every day you can pick up a newspaper or turn on your television and you're barraged with conflicting information about your diet, what may cause cancer, and what is the right path to take for a healthier life. Most experts agree that better informed consumers can make better decisions. And many consumers rely on magazine subscription services like Publishers Clearinghouse to give them a wide selection of magazines that provide a wealth of reputable health-related information.
Publishers Clearinghouse was founded in 1953. We've always offered a huge variety of reading material for the personal enjoyment and benefit and health of our customers. Approximately 25% of our magazine titles include health-related content on healthy lifestyles, diet, and nutrition. We started the world-famous Publishers Clearinghouse sweepstakes in 1967. Nearly 50% of our company profits go directly to charity to benefit the environment, the arts, and valuable social services. We also sponsor our Good as Gold Awards program, which annually honors 10 outstanding community service volunteers.
I just won $10,000! You have got to be kidding!
I'm here to give you a check for $25,000.
Oh my God, that's beautiful!
We surprise those winners with roses and balloons and big checks, just as we've surprised our sweepstakes winners with over $125 million worth of prizes over the years.
Through high-profile events like the multi-million-dollar giveaway during the Super Bowl, Publishers Clearinghouse can offer an even wider range of health-related and other merchandise, as well as discounted magazine subscriptions.
My family suffers from everything from migraine headaches to anemia, and I find that many of the articles that we read in your magazines at Publishers Clearinghouse have given us ideas of how to cope with our health problems in different ways, in better ways, and I have found that they work. I think magazines are definitely the source for busy Americans who are on the run and who don't have time to sit in front of a television set and watch a special on health issues.
I do enjoy a wide variety of fitness and health magazines because I think there's a lot in them, and they're very helpful to me personally and my family. And I have encouraged other people in my family to read up on things, and I've cut out articles because I believe that the doctor can't do everything.
Do you know enough about the topics you need to understand in order to make healthier lifestyle decisions? Subscribing to health-related magazines can keep you better informed. And by entering the sweepstakes, there's a chance you could become healthier and wealthier.
Right now, many people are struggling with difficult health issues as either patients or caregivers. Hopefully, their struggles will help us all realize what a precious gift good health is and inspire us to take the proper steps to maintain and improve our own. I'm Faith Daniels. Join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.